I'm Dr. Stacie Grossfeld, an orthopedic surgeon from Louisville, Kentucky. This morning I'm going to talk a little bit about the ACL injury. So you tore your ACL. What does that mean? Well, if you think you tore your ACL, and my last video I talked about the 3 signs that would give you an 85% chance of tearing it, is if you hear a pop or feel a pop, you have acute onset of swelling that occurs within 12 hours, and you cannot finish the game. That's an 85% chance you've torn your ACL. So if those happen and you think you may have torn your ACL, the first thing you want to do is ice. If you have no issues with anti-inflammatory medications, an anti-inflammatory medication, and compression with like an ACE wrap or a slip-on knee sleeve. That would be your first step. The second step is you'll want to get an appointment with your orthopedic doctor, or you can start with your primary care physician, who will then most likely refer you to see an orthopedist. Your orthopedist will do an examination, and the key part of the examination is he or she will tug on your knee, and if your knee feels loose, that is called a positive Lockman's test, which would indicate that you tore your ACL. Or there's also another test called an anterior drawer test, where we kind of tug on your knee, and if your knee is loose, you've torn your ACL. We will then most likely order an MRI scan. That will help confirm the diagnosis. It will also help tell us if you've torn your medial or lateral meniscus. It will tell us the degree of bone bruising that has occurred at the time of the injury. Sometimes you'll even knock off a piece of the cartilage that covers the ends of the bone. So we'll have that information with the MRI scan. So the MRI scan just gives the surgeon a lot more information. Do you need surgery? Well, surgery is variable. It depends on what you do. If you like to do twisting, turning, jumping activities, you need your ACL. If your biggest form of sport is playing a video game, you don't need your ACL. Or if you are a cyclist, you don't need your ACL. So it kind of depends on, and that's something your surgeon will discuss with you, whether you actually need to have your ACL reconstructed or not. If you come to the point where surgery is where you would like to proceed, the next discussion your surgeon will have with you is what type of graft will you use to reconstruct the ACL. So you can't actually sew the ACL back together. Once it's torn, it's torn. It's not repairable. You can't repair the ACL, so you have to reconstruct it. So there's several different types of graft options to reconstruct an ACL. One is the bone patellar bone. The second one is the hamstring graft. Very rarely people will use a quadricep graft. And then the final one is using what's called an allograft, where we take somebody else's tissue. My next video, I'm going to discuss more about graft options. Thank you.